Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by verifying the Lumenstone Adjuvant vial, lot number, and expiration. This prevents wasted doses. Once confirmed, put on gloves and assemble a sterile 1 ml syringe. Draw the specified volume, for example 0.5 ml, slowly to avoid bubbles. Then, gently invert the vial 8 to 10 times to mix. Do not shake or vortex, because that can denature the formulation. Make sure to work on a clean surface, and have the antigen ready for the next step. You now combine the antigen with Lumenstone by adding the antigen dropwise while holding the adjuvant vial steady. This controls concentration and prevents local precipitation. Once added, transfer the combined liquids into a 2-syringe connector and push back and forth 20 to 30 times to form a stable emulsion. This creates consistent particle distribution, which improves immune response. After emulsification, check for a uniform milky appearance. Then, label the syringe with batch details, time, and your initials before administering. You complete the process by selecting the correct route and dose according to protocol, and by confirming patient identity and consent. This prevents errors. Administer the Lumenstone Adjuvant injection slowly to reduce pain, then observe the recipient for at least 15 minutes for acute reactions, documenting vital signs and any local effects. If the emulsion appears separated, or if the patient has severe pain or rapidly expanding redness, stop and follow emergency or protocol escalation steps.
Thanks for watching. Consider subscribing if we helped you.